Having an insect stuck in your ear is a horrible experience, both for you and for the insect. That's because once it gets from the external ear down the auditory canal, it gets blocked by the tympanic membrane. Many insects can't walk backwards, so it often freaks out and starts clawing at everything and scratching around, and it makes an incredible amount of noise. It hurts, it feels horrible. It's your job to confirm the diagnosis, then quickly and mercifully kill the insect invader, and lastly to remove its loathsome corpse. So to confirm the diagnosis you have to look, but the problem is that most insects get agitated and freak out when you shine light on them. This can make your patient a lot more uncomfortable. The key to getting around this problem is, if you can do it, to make a red light, because insects can see pretty well into the ultraviolet, but not well into the red spectrum at all. By using a type of light invisible to the insect, you're less likely to agitate it and your patient. You can do this by taking a red dry erase marker and rubbing it on the otoscope light source like this. As you can see, the light turns kind of reddish, which is what you need to keep your insect in the dark. And when you're finished, the dry erase marker wipes off easily, leaving your equipment completely undamaged. Your next goal is to kill the insect. Simple drowning can work, but because water has a strong surface tension, and because insects do not transport oxygen through a circulatory system, but rather through direct air channels in their body, sometimes water simply won't fill up all these channels, leaving a reservoir of oxygen inside the insect, allowing it to survive longer and writhe in its death throes. You can kill the insect much more quickly if you use a liquid without surface tension, such as Colace or mineral oil, because these liquids will immediately displace the entire oxygen reservoir in the insect's respiratory system, resulting in a quick death. Probably the easiest place to find mineral oil is in a mineral oil enema. Almost every department has these, and you can just pour a little bit out and aspirate it up in a syringe, and then put a few drops in the patient's ear, and the insect will be dead in seconds. And you don't have to tell the patient that you just put an enema in their ear unless they ask. Another good option is putting a liquid into the ear that is toxic to the insect, such as plain old lidocaine. This will poison the insect as well as suffocate it, and provide some topical anesthesia for your patient's ear. You can use aqueous lidocaine or viscous lidocaine, it's up to you. Once the insect is dead, you have to remove it. I usually do this by flushing the ear with some warm water or saline, which brings the insect's corpse down to the opening of the auditory canal. If the insect is tough, like this beetle that I actually removed from a patient, it often comes out in one single hideous piece. If it's squishy, you kind of have to perform a partial birth abortion sort of technique where you take out one chunk of the insect at a time and irrigate the ear repeatedly until it's all out of there. Make sure to check at the very end so that there aren't a few egg sacs or something left inside that you missed.